Hey, it's your girl Manny Boo, and I'm back with another video. I've been away for a while. I had a lot of things going on last year, but I'm here to give you a small update on something that I've been going through. I did find out last year in 2019 that I have PCOS. PCOS is polycystic ovary syndrome. Most of you may not know what this is. Some of you may know what this is because a lot of women actually experience this and go through this. And just want to give you some information on it and give you a little bit of information on what I've been going through. So, first question is, what is PCOS? PCOS is a hormonal disorder causing enlarged ovaries with small cysts on the outer edges. It is estimated that between 5 to 10% of U.S. women of childbearing age have PCOS. So that's roughly about 5 million women. That's how common this is. What are some of the symptoms? So symptoms include menstrual irregularities, excessive hair growth, acne, and obesity. A lot of women will experience a lot of hair growth around their chin area, so it may seem like they have like 5 o'clock shadow. A lot of women experience a lot of hair growth on their chest as well. Acne. A lot of people, women get acne on their jawline or on their cheeks, or sometimes just all over their face. Depending on your skin color, you may experience a lot of redness or dark spots. One thing that I started to notice on me was a little bit of hair growth, and some dark spots were starting to form on my face. So that was something that I had to pay a little bit more attention to. So the symptoms that I've experienced was that I stopped having my menstrual cycle, and it was hard for me to lose weight, which that is something I'm still struggling with. But I do feel like weight loss is something that you can't control. So even though it may be a little bit tougher, I do think that is something that I can control, and I can be a little bit more better about that. And like I mentioned just before, I also noticed that I was having a little bit of hair growth on my chin and some acne. So how did I find out that I have PCOS? So me and my husband, we have been trying to conceive for about a year. Fortunately, we didn't have any luck with that yet. And my menstrual cycle started coming later and later. So at one time it will come a week late, then it'll be 2 to 3 weeks late, and then one time it was 8 weeks late. One day I did have severe pain, and after missing my cycle for about several weeks, the pain was just like really bad. I was balled up like a baby, crying. Then I ended up going to the hospital. Got to the hospital, and they said that they wanted to take out my appendix. I'm like, my appendix? Like, what? So moments before I was about to go back to have the surgery, the surgeon came in, and he looked at me and was like, it's not your appendix. He was like, yes, your appendix was swollen, but a lot of organs in my lower abdomen area were also swollen, so there was no need to take out my appendix. He sent me home with a prescription, and I started that prescription, and then the next thing you know, I got my period. That period was definitely different. Of course, you know, it was still painful from the pain that I was experiencing, and it was very, very heavy. So to this day, I really don't know what was going on and what the cause of that was. But once I had that period, I didn't have another one. The next 2 that I was supposed to have, missed them completely. So normally they would just come late, but at that time I was missing them and I wasn't getting them back. So I did go ahead and contact my doctor, and actually started seeing a new OBGYN because the one that I was going to they weren't returning my phone calls, and I didn't have time to be waiting around for them to get back to me because I needed to know what was going on. So luckily my husband, because he's very quick on his feet, found a new OBGYN for me that's in our area because we just moved to another city, and I started going there. I went to the doctor, and the first thing they wanted to do was a vaginal ultrasound. So that's where they, have the ultrasound that they can, stick in your vagina, and they can take a look in there and take clearer pictures than from what they can do just by going over your stomach. And as soon as the nurse put the ultrasound in, the first thing she said was, "Do you have PCOS?" And I was like, no, I kind of really don't know what that is. And she was like, "Oh, okay, you probably got nothing to worry about. I was just wondering because a lot of ladies that come in, they say that's something they have, so I just wanted to check." But of course that had me worried because I'm like, well, dang, what did she see to make her ask me if that was something that I have? So I then, get done, and I also did some blood work. The doctor came in and she spoke to me, and she made an appointment for me about 3 days later. That appointment, we were going to discuss the photos that they did take with the ultrasound, and also to review my blood work. When we had that follow-up appointment, it was virtual. I was at work, so I just took a lunch break and I talked to her. She did let me know that I was not ovulating. I was not dropping an egg for ovulation, so that's the reason why I was not becoming pregnant. And she also let me know that she was a little worried about my thyroid levels. Back in 2014, I had my thyroid removed. And so I have to take levothyroxine for the remainder of my life. That way I can get the hormones that I'm not getting since I no longer have the thyroid. So one thing that I always have to do is continue to get blood work done just to see what my levels are. My levels are fine, but she stated for a woman that's trying to conceive, she needs for them to be a lot lower. So she went ahead and let me know that I do have PCOS. And we were going to go ahead and start a treatment to try to figure out what's going on, figure out how they can, get this fixed and taken care of for me. All right, so then we had to, go ahead and get a goal and some treatment started. So what goal and treatment was set? The goal is to jumpstart ovulation and have regular menstrual cycles again. For the treatment, I was put on medroxyprogesterone, which is also known as Provera. She gave me 10 milligrams. I had to take that for 2 weeks. And she also did an increase on my thyroid medication because she wanted my levels to drop a little bit. She wanted my levels to really be anywhere between something less than 2.45. Something less than that is what the goal was. Provera was supposed to help me shed the lining of my uterus, which is basically what your menstrual cycle is. Your lining builds up and you shed it, and that's what a period is. I did not have a cycle, so when my next appointment came, we had to think of something else that we could do. She stated the next thing that she would do is just to add an extra step to what we were already doing. The next step was for me to take Premarin. I did take Premarin, which was about 1.25 milligrams. I had to take that for about 3 to 4 weeks. And then I had to go back on Provera for 2 weeks. So the Premarin was supposed to help me build the lining in my uterus. And then the Provera was supposed to help me shed it so that I can have the period. Once I started taking Premarin, I did have like a light period. It wasn't a normal period. Just because it was light, that was a good sign, because if I didn't have any type of period, the next thing that they were going to do was dilate my uterus so that they can take a look in and see what type of blockage I had. But since I did have that small light period, I don't have blockage. So dilating my uterus, that was something that we no longer had to do, which of course made me happy because I joined a support group, and there's some women who went through that procedure and it's uncomfortable. Some people said it's painful, and of course that's not something I wanted to do. So now that I did have that period and it was light, I went to my next appointment. my doctor did let me know that she still want my thyroid levels to drop just a little bit more. She told me the importance is that is because when you do conceive and have a baby, if your thyroid levels are not low enough, that can cause a disability with the baby. That can cause a disability with the baby mentally and the growth of his brain. So that's why it's very important to make sure that my thyroid levels are a-okay. So she also let me know, because I still haven't had like a normal period, that the next step that she's looking into is checking to see if my tubes are open. So we would have to do a small procedure where I would have to be sedated just a little bit. They would need to insert dye, and they need to follow the dye and see if the dye is going to travel through the tubes. If the dye travels through the tubes, then that means that my tubes are open, and of course if not, I mean my tubes are not open, and then we would have to do something else from that stuff on. So that's where I'm at in the process of trying to get my PCOS treated and trying to conceive and have a baby. Also, something that she put me on was a keto diet. She said that women who have PCOS, being put on a keto diet is probably one of the best types of diets for a woman, just because you get all your protein and things that you need from meat. And when it comes to vegetables, especially green vegetables, she stated that it's very healthy for a woman, and it gives the woman the body, the nutrients and things that the body needs to treat PCOS and to help them conceive and have a child. How have I been feeling mentally and emotionally through this process? I think one of the harder things was that last year was one of the years that everybody around me just seemed to be pregnant. I mean, people are always pregnant around me, but I feel like last year everybody was pregnant. So I was going to a lot of baby showers, like drive-through baby showers and stuff like that, because you know we still have to be safe due to COVID. And a part of me, you know, I would get sad because during that time where my periods were late, I was thinking that I was pregnant. And so I was taking a lot of pregnancy tests, and every time a pregnancy test was negative, of course, I was a little sad and emotional, and I'll just cry to myself, and then I'll just try to move on from it. Mentally, I think I'm okay, because even though everybody's pregnant, I'm still happy for people. Like, I don't want no one to feel like they have to hide their excitement for their pregnancy and a new baby, because I'm just as happy for you that you are for yourself. So it wasn't something that I feel like I'm struggling with mentally. I don't fault anyone. Like, I'm always happy for people. So it wasn't something that I felt like I needed to stay away from people. I was really happy for everyone. And I think mentally and emotionally, I'm holding on pretty strong. Of course, you know, you get sad every once in a while, but I'll be okay. So once I speak to my doctor, I do have another appointment coming up, and we're gonna see what we're gonna do. I'm pretty sure the next step will be to see if my tubes are open, because I have not had a regular period. I'm still waiting on it to start now, but of course, if I do, I'll make sure to get you guys updated. So what have I been up to? So last year in April, me and my husband closed on our first home. So we are homeowners. We did move about 30 to 40 minutes north from where we were living at. And I do have some family in the area, so I'm not completely far away from family, but we're homeowners. I'm actually sitting in the office right now, and it's been a good experience. You know, it's a lot more responsibility. You can't call on the apartment complex people to come and do stuff for you. You have to do it on your own when it comes to gardening, cutting grass. If something breaks, you're the one that's responsible for fixing it. So there have been moments where I'm like, oh, you know, but I like it. It's very private, and hosting is something that I never thought that I would enjoy, but I actually like hosting small events and things like that. And of course, we needed the space because we want to start and have a family. So it's a great thing to have and a great experience. Well, I hope that this video was a little bit more informational. I hope that this give you a little insight of what I've been going through. Maybe you or someone you know has been going through this, because like I stated, this is very common in women. And I'm very excited to be bringing to you guys more content because it has been a while. So please make sure that you do like, share, and subscribe to my channel, and be on the lookout for more videos. Yeah.